Alright, imagine it's a normal Saturday afternoon and you take your children to the park for a day of relaxation and quality time. Out of nowhere, you begin to have unexplainable, unbearable abdominal pain. In fear, your wife calls 911 and an ambulance comes to rush you to the hospital. You arrive at the hospital, and upon arrival, you're examined by the doctor to find out the cause of your abdominal pain is due to a burst appendix. You're rushed into emergency surgery in an attempt to save your life. The surgery begins to take longer than expected due to unforeseen circumstances. All the while, your family's waiting in the waiting area with no word how the status of your procedure. Eventually, the procedure is complete and all is well. After a few nights in the hospital, you're sent home, and a few weeks later, you receive a bill in the mail for nearly $175,000 in medical services. You're still in recovery, you've been out of work, you haven't been cleared to go back to work, and worst of all, you're uninsured. Now you're stuck with this bill with no idea how to pay it. In the United States, 27.1 million Americans report lack of health insurance as of the first quarter of 2024, based off a survey released and conducted by the Department of Health and Human Services Assistant Secretary for Planning and Evaluation. In today's economy, Americans find it difficult to find affordable, accessible, and quality health insurance that suits their needs and standards. The United States government does offer health insurance for its citizens. However, these options often leave consumers underinsured and left to pay out-of-pocket costs. As a child, my father met with several specialists and underwent several surgical amputations. We often received medical bills in the mail, but being that my father was uninsured, we were just directed to throw these bills in the mail. Many Americans today often face the same struggle with stress and frustration, wondering how they will be able to cover the cost of their medical expenses. A survey conducted and released by the Commonwealth Fund surveyed 8,201 Americans of their health insurance status. This survey found that 23% of participants reported being insured all year round, but reported being underinsured. 12% of participants had gap coverage, whereas 9% reported being uninsured. Being underinsured or uninsured can take a serious mental toll on a person's life. This survey found that 79% of participants reported feeling anxious or worried about their medical costs. 41% of participants state that they had to use part of their savings to cover medical costs. 38% of participants stated that they had to cut back on basic necessities like rent, food, and heat. 36% of participants reported that they avoided seeking needed healthcare services or filling prescriptions due to the cost of services. 28% found effect in their credit score. 24% had to find another job to cover medical expenses. 14% held off moving or buying a new home. 12% had to delay their education, and 2% had to declare bankruptcy due to the cost of their medical expenses. Participants also reported being burdened with the medical debt ranging from $500 to $5,000. Medical debt has put millions of Americans in financial distress and has caused those people to turn away from the healthcare system and avoid seeking treatment for the use of needed prescriptions, drugs costs. While Americans are burdened with the stress of paying medical costs or forced to put their health on the back burner, there's only one solution to the problem: universal healthcare for all American citizens. All countries around the world but 43 offer universal healthcare, the United States being one of those 43 countries that does not offer universal healthcare to its citizens. According to the World Health Organization, every country has a different idea how to achieve universal healthcare depending on the needs of its population and resources. However, the United States should strive for universal healthcare as a way to care for and prioritize the needs of its citizens. Americans should be able to access the use of medical services when needed without fear of medical debt. Universal healthcare for American citizens should provide peace of mind, ensuring Americans are getting the best care possible, and ensure patients can leave without the stress of a bill coming in the mail. Free healthcare services would result in a healthier population, as patients would not need to hold off on receiving services for primary care practices, specialty care, care for chronic diagnosis, or even using or filling medical prescriptions regardless of a person's race, ethnicity, age, gender, financial status, or employment status. When the government resources like Medicaid, or Medicare, these resources are not allotted to all Americans, leaving most Americans to seek third-party insurance or health insurance through work. With these resolutions like these, Americans are left to pay co-payments or premiums, and at times can break the bank for some people. Americans are often faced with stress and anxiety when facing medical expenses, along with citizens that are left to postpone life milestones, cut back on payments for necessities, or seek needed healthcare due to costs. Americans should have access to free quality healthcare without worry. The United States government should determine its priorities and prioritize the needs of its citizens.